Hi guys, welcome back to my channel. Thank you so much for watching. We did a lot of grammar things the last couple of weeks, and that's why I decided today to have our third, I think, or fourth vocabulary session, just to relax a little bit and keep our minds off the grammar. The topic today is Gesundheit. If we talk about health in general, we don't need an article, but if you want to use it, keep in mind that it is female. Die Gesundheit, the health. And we have 4 categories, and we will check them out one by one. First one, Gesundheitsprobleme. Here we have 2 things we can check out. It's a little grammar related, but not much. If we have 2 things, and we put them together, it's really often the case that we have an S in the middle. It makes sense. You can remember it like Michael's problem or Anna's problem. The S is an indication that the second thing is something of the first thing. So, Gesundheitsprobleme, problem of the health, so to speak. And it's plural and a general statement. So this is why we have no article here. Die Krankheit, the sickness. Die Erkältung, the cold. Die Allergie, the allergy. Die Vergiftung, the poisoning. I hope I wrote it correct. It looks a little strange. Poisoning. Okay. Die Infektion, the infection. Here we have typical nouns, and we see at the end heit, again ion, I. This is so typical for, of course, nouns, but also for things that are not touchable. For example, die Erkältung, this UNG at the end, the opinion, die Meinung, the division, die Spaltung. You know what I mean? Those kind of endings are really a good help. That makes it almost always clear that there is something untouchable, the topic. If we have sickness, cold, allergy, poisoning, or infection, we have the easiest way to say it with a haben. Hat eine Erkältung. He has a cold. A general statement. This is why we need the indefinite article. If things like that confuse you, please check out my grammar videos. Seine Erkältung ist sehr schwer. His cold is really heavy or serious, we could say. We haven't learned yet to say his and her. We will learn this really soon. But I think it's not so hard to grasp. His cold is really heavy. The opposite you can say leicht. For example, you are in your office and you see Paul always sneezing, whatever, of course, without COVID existing, just a scenario. And you can say, hat Paul eine schwere Krankheit? Does Paul have a heavy sickness or eine schwere Erkältung, a heavy cold? And the answer could be, nein, nur eine Allergie. No, only an allergy. Okay, so I repeat, to use this kind of health problem words, the easiest way with to have a, and if you want to describe it a little bit, you can use it like any other combination with adjective and the verb to be, ist, and an adjective. Next one, Symptome. It's plural, die Symptome. By itself, it would be singular, it is das, it's neutral. Das Symptom. The symptoms. Der Schmerz, the pain. Das Fieber, the fever. Der Husten, the cough. Niesen, to sneeze. Der Ausschlag, the rash. So again, we have some nouns here, which are really easy to use. Again, ich habe, and then you have to say what you have. You can either keep it general and you can say, I have pain, Schmerzen. Then it is plural. If you decide to say a pain, I have a pain in my chest or in my leg or whatever, then you have to say, ich habe einen Schmerz. Some people say it also like this in singular, einen Schmerzen, because it's accusative, But to be honest, German people almost never say it like that. Ich habe einen Schmerz. And then, of course, you can continue. Im Bein, in my leg. Depending on what grammar gender your body part has, you have to change it. Im Bein, in my leg. In der Brust, in the chest. Im Kopf, in the head. The same grammar goes also with fever. Hat Fieber. You have some options to describe it. Hohes Fieber, high fever. Niedriges Fieber, it's like lower fever. It sounds a little strange. And leichtes Fieber, which is like the small fever, easy or light fever, like 37 or something. If the fever is the subject of your sentence, you can use those kind of verbs. For example, das Fieber sinkt, the fever sinks or goes down, or das Fieber steigt, the fever goes up. Der Husten, the cough, and here you can see the same. Starker Husten, a strong cough. Leichter Husten, a light cough. Schmerzhafter Husten, a painful cough. And the last one, trockener Husten, a dry cough. To sneeze is the only verb we have here. Niest, sie niesen, and so on. It's super easy. But it is not a noun. If you want to say sneezing is a part of the symptoms, for example, you have to say der Niesreiz. Here we have another kind of two things making a bigger word. In this case, we have the verb to sneeze, and then we have the noun for trigger. So your nose is triggered to sneeze, der Niesreiz. And the last one, der Ausschlag, the rash. Here you can also say der starke Ausschlag, the strong rash or the extreme rash, der leichte Ausschlag, der schmerzhafte Ausschlag, trocken, a dry rash. I don't think so. It's not wrong, but it's not really natural sounding. But the other three are the same as we learned before. And again, just for practice, if you want to make it general, you can say, every summer I have a rash, for example. Jeden Sommer habe ich Ausschlag. And to make it more clear, you can say, jeden Sommer habe ich einen Ausschlag, if you want. Another verb, if you don't want to say all the time to have, which is not wrong, you can do that. Bekommen, to get. For example, he suddenly got fever. Hat plötzlich Fieber bekommen. Hat Husten bekommen. He got a cough, and so on. For pain, it's better to say he suddenly felt a pain. To feel is fühlen. So you can say, fühlte plötzlich einen Schmerz. If you don't want to say to have. If you're not sure about it and you want to say it's an emergency and you want to describe something, please use to have to make it quicker and more efficient. Next one, Behandlung, treatment, it's female, die Behandlung. Das Krankenhaus, the hospital. Der Patient, the patient. Die Patientin, female patient. Die Spritze, the injection. Behandeln, to treat. And because of our really unusual situation worldwide, let me give you the vocabulary for vaccination. Die Impfung. Okay, das Krankenhaus is, of course, a place, so we need another kind of preposition, another kind of statement, because we don't say I have a hospital. I mean, if you do, congrats, but it's not usual to say that. So, geht ins Krankenhaus. He goes to the hospital. You can also say it, muss ins Krankenhaus. In this case, you can leave the go out. It's not necessary. If you're not sure about it, you can say it. At the hospital, im Krankenhaus. He comes out of the hospital, or she, aus dem Krankenhaus. So, for example, when is he leaving the hospital? Wann kommt aus dem Krankenhaus, for example. And then you can say am Montag. War 2 Tage im Krankenhaus. He was 2 days in the hospital. I'm just giving you all this because I want you to see the prepositions that change but we will talk about stuff like that in my grammar sections also. The patient and the female patient, I think it's clear. Die Spritze, the injection. You cannot say I have an injection. It sounds a little creepy, but the same as before, you can receive or get an injection. Eine Spritze bekommen. It is interesting. In English, you say I'm giving you an injection for the pain. We can say this in German as well. Ich gebe Ihnen eine Spritze für die Schmerzen. But you can also say, ich gebe Ihnen eine Spritze gegen die Schmerzen, against the pain. So fighting the pain. So both is fine. And the line between it, it's not really easy to understand. It's a kind of feeling you have to get for the language. Wofür ist das? You can say, what is it for? And then they can say, for the pain. Or you can say, wogegen hilft das? What does it help against? And then you can say, it helps against the swelling or whatever. So it depends on the context, how you want to use it. And behandeln, to treat, right? This is the easiest part. It's a normal verb. Der Arzt behandelt viele Patienten. The doctor treats many patients. Since we talk about getting better, the last chapter today is the pharmacy, Apotheke. If we have it with the article, it's female, die Apotheke. Here we have a lot of things that sound so much the same. You will say, finally, something easy. So let's read. Die Tablette, the pill. Die Kapsel, the capsule, das Vitamin, the vitamin, das Thermometer, the thermometer, die Medizin, the medicine. I think it's all self-explanatory. Let's try to make it with our sentence we just learned. We can say, wofür sind die Tabletten? What are the pills for? Diese sind für den Husten und diese sind für das Fieber. Those are for the coughing and those over there are for the fever. I don't know how you feel, but I cannot swallow capsules. Let's say this sentence because I think it's useful, especially if you have children and stuff. Die Kapseln sind zu groß. Ich kann sie nicht runterschlucken. The capsules are too big. I cannot swallow them down. So, to swallow medicine, you use this verb here, runterschlucken. Das Vitamin sounds really stupid in German, I must say. I wanted to give you the singular, but please don't use it like that. It is die Vitamine. Das wichtigste Vitamin ist. Of course, this is correct, but we don't say it like that. It's more common to say vitamins are really important or something like that, right? So the plural is more natural. Das Thermometer. I can give you a vocabulary here to use something, to use the thermometer. Benutzen, to use. Or to check your temperature with a thermometer, it is messen. Messen by itself means to measure. But of course, we can use it also for the temperature. Misst jeden Abend seine Temperatur. He measures every evening his temperature. Medicine, we can say to have medicine against or for something, of course. To swallow medicine, we learned. But we can also say to take medicine, of course. It is the easy verb nehmen, to take. Nimmt jeden Tag 3 Tabletten, 2 Kapseln und eine Medizin für seinen Magen. He takes every day 3 pills, 2 capsules, and a medicine for his stomach. Of course, in this case, we have to say for his stomach because no one would take a medicine against his stomach. If you would say for his stomach pain, you could say gegen seine Magenschmerzen, against his pain. The against must be something negative, of course, against the pain. But for his stomach, for a soothing stomach, for example, it's for. Okay, I really hope you learned something new, and I really hope you will never need this kind of vocabulary in your real life, but it's always important to know them. If you have questions, leave it in the comments below. Next time we will continue with grammar, of course. Until then, stay healthy, take care of yourself, and learn some new words in German. See you soon. Bye.